Good evening, everyone. Thank you for having me. I'm Omar Partida. Had the pleasure to be with Koios now going on 5 years. So we're excited about today's event and presenting our product to everyone. So this is like a really fast tempo. So apologize in ahead. We're not used to sort of presenting like this, but I will do my best effort to try to condense everything as short as possible. So ready when you are. All right. So tonight we're going to talk about breast cancer and thyroid cancer diagnosis challenge that's currently impacting millions of individuals across the world, and the innovative solutions that we need. And so at Koios, we put the AI in ultrasound, and our slogan is confident diagnosis in seconds. We know that early detection is key, and everyone, I think, understands the clinical pathway in breast cancer detection, from mammography to ultrasound to biopsy. But it's a very difficult process, right? And in this process, there's many biopsies. Time passes, and worse, cancers are missed. They're then called interval cancers. Very similar in the thyroid detection panel. We have the same. To make things worse, there's a very high prevalence of thyroid nodules. So about 68% of population will have benign thyroid nodules, and a very low positive predictive value. Only 5 to 7 of those are actually malignant, and a very high sensitivity with more than 95% of those biopsies coming back benign. Although all these important tests are important, again, there's a patient behind this, right? There's a patient that's stressed, there's a patient that feels afraid, and we need better solutions. We need better tools to help these patients. To talk about the solutions, we really need to understand the challenge, right? We know that physicians are highly trained individuals, radiologists, trained on very complex lexicons to understand these subtle nuances and images. But again, they're human, and they're subject to interpretation fatigue, biases, and errors. On the left here, we can see an image. We have 3 physicians. When they get a diagnosis or a prediction, they're going to have 3 different opinions. And so they're going to look at half a dozen features. With Koios, we align and we harmonize those diagnoses, and we reduce this physician variability. So I'm here to tell you that AI is here to help. There's many AI solutions, but with Koios, one of the things that you'll learn today is we're going to reduce unnecessary biopsies. Statistically, it takes about five biopsies to find this one cancer. What if a solution can tell you when to biopsy, when up to a biopsy, and achieve these better outcomes? We achieve these better outcomes using the power of data. We harmonize data in a way that physicians don't get to see this data in their lifetime. We use machine learning to create these algorithms to recognize these very subtle lesions, and together with human, we augment their diagnostic accuracy. I can tell you that our data set came from over 52 centers throughout the world, using all the different manufacturers, transducers. We then created this algorithm that can find over 17,900 features in every single ROI, predicting the likelihood of malignancy. Now, we train our system on pathology. We're not CAD, we're not computer diagnosis, we are decision support. We're there for the physicians when they need us the most. We're a second opinion on demand when needed, when they have a question, when they're not sure, when they are not sure if they biopsy, shouldn't biopsy. This within the tool can be used. In our landmark breast study, we have great data that we've seen. The important thing is we see that sensitivity goes up and specificity goes up at the same time. All wonderful metrics. The benefit of that, or the outcome of that, is we see a reduction in benign biopsies, ultimately helping these patients. Now, that retrospective data also translate to prospective data. So in our clinical use, we see physicians, as soon as you start using our data, our software, the benign biopsy rate goes down, the positive predictive values go up, and ultimately it's a better diagnosis and workflow for the physicians and the patients. In our thyroid product, we completely automate the reporting. We provide all the descriptors, either in TI-RADS or ATA. We also provide a adapter, and we can automate all this information and create the report for the physicians in less than 3 seconds. Again, very similar in our landmark thyroid study, which included 4 physicians from Europe. We had improvement in sensitivity by 14%, improvement in specificity by 37%, reduction in variability by 54%, and reduction in interpretation by 24%. We've been around for quite some time. This is an important thing, right? So our first FDA was in 2016. We now have 3 FDA approvals in our product. We have 2 CE marks. We have a global agreement with General Electric. We have both breast and thyroid products. In the US, we have CPT codes, which insurance companies will reimburse. And we also have many awards, including Breakthrough Device. And we're excited about launching and commercializing in further parts of Europe and the world. I think we have a stuck slide. Great, gives me more time to speak.
I'm sorry, moving on.
Probably the most important thing, right, is how do we integrate? How do we work? So we're on demand, on site. We not on the cloud, so we are installed on site. It's a web server, either physical or virtual machine. Uses Windows operating system. It integrates with all the different PACS system using a URL trigger, which is part of every PACS system. Again, as I mentioned, we always joke around that we integrate from A to V, from ACFA to Visage. All this different PACS system easily plug into Koios, or Koios plugs into them. We then can export in DICOM SR and auto-populate these reports, really reducing about 49% of the workflow and the time that it takes to create those reports. We also have a global agreement with GE. So GE has Koios embedded on the E10, on the Fortis, and on the ABIS, allowing our technology to be used on demand at the moment of acquiring those images. And again, it's on-demand second opinion. The important thing is, what is ROI, or the return on investment, or the value that we provide? So for every 10,000 cases that is used, we're going to find additional cancers that translate into savings, unnecessary biopsies. And again, we have the efficacy and the validation, both retrospectively and prospective. We're installed in over 125 customers in more than 30 countries. And here today is really about asking you guys to join the Koios team, right? So we're looking for distributors that can help us expand our technology. And we're really happy to participate to it and answer any questions that anyone may have.